All right. Welcome, everyone. Thank you so much for joining us today. As a reminder, this is the Mental Health Community Collaborative, a virtual learning series by the Translational Health Research Center at Texas State University, and we are happy that you are here today. Quickly, my name is Cody Gould. I am the host for today. The Mental Health Community Collaborative is an amazing virtual learning series that started a few months ago in the beginning or in late last year. Today marks our fifth session that we are really excited about. We have sessions going from now until the end of October. So this virtual learning series will last about a year. We meet once a month on the same Tuesday of every month, which is I believe this now is the third Tuesday. If you are excited about the content today, we hope that you join future sessions as well, which we'll be sending out later. This Mental Health Community Collaborative was created in conjunction with 11 mental health professionals within the surrounding mental health area, or within the surrounding Central Texas area, from North Austin to San Antonio, Kerrville to Bastrop. We connected with a lot of these mental health professionals to create topics that will actually draw in, real world conversation about how to enhance mental health in Central Texas. The session today it came out of that networking group and has led us to our conversation around Texas legislature and the impacts it has on mental health. We are happy to be joined by Alison Mohr Boleware, who is the Director of Policy for the Hogg Foundation. Again, she will be talking with us about Texas legislature and its impacts on mental health within our area, as well as the state of Texas in general. After that, we're going to hear from Peyton Wagner from the Hays County Health Department. And then we're going to have some time for open questions at the end. So if you have questions, feel free to kind of keep them in your back pocket or write them down so we can cover starting around 12:30. And after that, we're going to have an amazing conversation about all that we've learned today. So I'm going to pass it to Alison, and thank you all for joining.
Hello, good afternoon, everyone. I'm so excited to be here with y'all today. Let me just make sure that everything is working here. All right, so y'all can see the full screen there. Excellent. My name is Alison Mohr Boleware. I'm the Director of Policy at the Hogg Foundation for Mental Health. I'm also a licensed social worker. I see many familiar faces in the chat and in the little Zoom squares, so I'm really excited to be here today. As Cody and Shelby explained, this group has worked really hard to create topics that we thought would be really impactful. And as the legislative session began, Cody and I connected, and I offered to speak on this issue because I think it's really important that y'all, as people out in the community, know what's going on at the Capitol during the legislative session and know what the impacts are on mental health services. So before we get started, I wanted to do a little overview of the Hogg Foundation for Mental Health, if you have not heard of us before. So we were established in 1940 by the children of Texas Governor James Hogg through an original endowment of $2.5 million from the estate of Will C. Hogg, which was the oldest of the Hogg children. And after Will passed away, his sister Ima and brother Mike established the Hogg Foundation for Mental Hygiene, which was the original foundation's name in his memory. The foundation has always been tasked with embodying the values of the Hogg family and working to improve mental health and well-being at the entire state of Texas. So we do grant making and policy work, research, etc. So about policy specifically, the policy unit aims to lead systemic change. And we inform state level policies that include funding and support for mental health promotion, prevention, and early intervention. And our goal is to affect systemic change, again, to improve the mental health and well-being of people across Texas, not just one area of Texas. Our grants are actually in 47 counties of the 254 counties. So we are really trying to broaden our stroke there. So I am going to leave this on for a couple of seconds. If you have your phone with you, I would love if you could scan this QR code. This is our little baby that we worked on for over a year. It is the Guide to Understanding Mental Health Systems and Services in Texas. So in this comprehensive website, we look at state agencies that receive mental health or substance use funding, and we also go through a ton of policy issues. So what you're going to hear from me today is just the tiny tip of the iceberg, but I encourage you to look at this guide website and to get more resources there and more information. So the Texas mental health landscape, where are we right now? I want to start with just aligning us with what the public mental health system is when we talk about the public mental health system. So in Texas, there are four main agencies that are related to mental health and substance use. We have Health and Human Services Commission, or HHSC, and HHSC is tasked with providing mental health services, children's mental health services, crisis services, and the state psychiatric hospitals. Most of this is done through contracts. So some of y'all may actually have contracts through HHSC to do the work that you do. And I saw on here that there were a couple of people who work for our local mental health authority. That is also funded through HHSC. And so when we talk about the public mental health system, we're talking about local mental health authorities. So Bluebonnet Trails, Integral Care, Harris Center, those are all examples of the 39 local mental health authorities in our state. We also have the Department of State Health Services, or DSHS. This is what provides substance use services, again through contracts, and maternal health services. So not so much on the mental health side here, but does touch substance use. Then we have the Texas Education Agency. So TEA is tasked with, amongst their, duties that you can assume, they also are tasked with school safety and school climate related initiatives. There is not dedicated funding for school mental health in the TEA budget. I'll touch on that later, but they do get funding that includes school climate. And then last is the Texas Higher Education Coordinating Board, or THECB. You may hear that and wonder, what do they have to do with mental health or substance use? But actually, the coordinating board is the one that has all of the mental health professional education items through it, because the coordinating board is who funds all of the institutes of higher ed. And so there are several workforce related programs and loan repayment programs that benefit mental health and substance use professionals at the coordinating board. So while they don't provide mental health or substance use services, they do work with the workforce and work to build the pipeline of workforce, so they are included in this agency overview. So where are we now? I wanted to start with framing where the last legislative session budget landed us, because in Texas, we meet every other year. So that means that we're currently in the state budget that they agreed upon in 2023. So because we meet every other year, we only meet for 140 days, the legislative session is very fast. So when we look at the state budget from last legislative session, I want to make sure that we're seeing on the far right column. I'm not going to go through all of these numbers, but I just wanted to highlight the three that I have bold and italicized: community mental health for adults, community mental health crisis, and the state mental health hospitals, or those state psychiatric hospitals. I wanted to show the increase of funding there between last session's budget and the 2021 session budget. You'll see that there were increases on all of these items, but when we look at community mental health and community mental health crisis, along with the state hospitals, they got a substantial increase. So that is our framing for what we are coming at from last legislative session. They are still debating the budget right now, and I'll go through that in a bit. There was also what is called a rider to the budget, which directs the state agencies how to spend specific funds. So there was a rider last legislative session directing HHSC to create one new mental health grant program that was created through a bill. And then there were also some other grant programs that were included in this rider. So there's $20 million for a veteran and family grant program, $80 million related to justice involvement and trying to reduce forensic commitment wait time, which I know is really important to a lot of people who deal with folks with serious mental illness that do not need to be in a justice involved placement. And then $45 million for community mental health grant program program aimed at rural communities, 23 million for a healthy community collaboratives, and then 15 million for a new grant program that was focused on community-based initiatives with children and families. And that was, through the creation of the program through SB 26. And really quick, just to again kind of give us a frame of mind, there was no additional funding last session for the school safety allotment. Now, the school safety allotment does allow for school climate uses. However, we know only about 2% of the funds were used on school climate. The majority of those school safety funds were used on things for the facilities or for hiring an armed guard because that is a mandate put forth to the state. There is also an increase of funding. Again, you'll see that far right column, an increase in funding to communities and schools. I know that Communities in Schools is a very popular, well-known program in the Central Texas area, and it did get an increase of funding last session. Again, the state budget does not have an individual item for K through 12 school mental health services and supports. It's important to note that there is also not a line item for mental health in higher education. That is dependent on how each institute of higher ed decides to fund that. I wanted to just show some workforce related initiatives when I talked about the coordinating board earlier. So here are some things that were included in the last budget. And a huge increase in funding for the mental health professional loan repayment program. If you are a licensed mental health professional and you still have loans, I encourage you to Google loan repayment program for mental health professionals Texas, and you can look to see if you qualify because a lot of people qualify that may not know about this program, and it got increased funding last session. There was also a substantial amount of funding in the Child Mental Health Care Consortium, and that includes some workforce programs. And then there was a new program created, a Forensic Psychiatry Fellowship Program. So again, trying to aim at addressing those forensic wait lists and the need for psychiatrists in that for that population. And then last, there was an increase in funding for opioid abuse prevention, $18 million, and that went to UTSA. I will skip through this. And then one thing that I did want to note is that there were over $2 billion dedicated to HHSC, including state hospital capacity construction and renovation. But what I want y'all to know about this is that this is a one-time funding. So while yes, that is a lot of funding, it is funding for infrastructure for these facilities. And again, it is only one-time funding. There was also $1.1 billion to TEA for the School Safety Initiative grants, and that was to allow schools to meet the requirements of the school safety mandates. But again, the majority of those funds were used on facilities and hiring of armed guards, not on school climate or school mental health. So where are we right now? We're in the 89th legislative session. The last day to file bills was last Friday. So we are almost at the halfway point. Again, we only have 140 days in the session, so things go really quick. The governor can call everyone back for a special session, but those are only for 30 days, and they're only on topics that the governor calls the group back for. So I wanted to start with showing what are the continuing issues of interest. What are things that we're hearing from legislators, we're hearing from staff, we're hearing advocates and stakeholders talk about a lot. These are the ones that have been really rising to the top. So on the mental health side, school mental health and youth mental health is one of the top things that people are talking about. People are very interested in how to prevent these things. Why are the numbers rising? Why are more people why are more youth needing mental health support than before? Youth crisis services. How do we navigate when kids and youth are in crisis and doing that in a way that keeps everyone safe? Suicide prevention. This is also something that legislators are very concerned about, especially those that represent rural areas and areas with a lot of veterans. Something that they ask about a lot is how to address suicide prevention. Workforce. This is kind of an evergreen item in Texas. I know that I'm preaching to the choir here when I say that there has always been a mental health workforce shortage in Texas, but then in the Central Texas area too. Excuse me, but it is something that legislators are very concerned about. Social media use and impact. They actually held a committee hearing during the interim where they talked about social media use and its impact on mental health. There have also been a number of bills filed related to this, and I'll speak to that in a bit. Parental consent is a big one. People are asking more questions about what do parents consent to in schools related to mental health and things related to emotional well-being, emotional feelings, conversations around those things. Forensics in state hospitals is also a big conversation in those ongoing wait lists. Infrastructure and telehealth. People are still concerned about broadband. People are still concerned about how telehealth will work in the state. On the substance use side, harm reduction, fentanyl testing strips and other types of testing strips is a big conversation. Overdose prevention, looking at ways to improve existing Good Samaritan laws, which would protect people that are taking someone to the hospital during an overdose, recovery housing, funding around that, youth prevention, so how to actually prevent kids from engaging in substance use, including vaping. That's a big conversation, and THC. And then last is general education on substance use and related stigma. There's still a lot to navigate there and a lot of questions about substance use still. So the base budgets, that means both the Senate and the House have filed their original budget. They have already had hearings on the budgets, and the public was able to come give testimony on that. The committees that are in charge of the budgets have already made changes to those budgets. And the next step in the process is both the House and the Senate will debate their budgets with amongst the other senators and other representatives. And then they will come together after that version of the budget and create one final version of the budget. Essentially, creating the budget is the sausage making, for lack of a better term. It's where everything gets kind of mixed together. A lot goes on behind the scenes to do it. But the things that I thought y'all would be most interested in is that the base budgets do include either an increased or consistent funding from last session for community crisis services, community children's services, youth crisis outreach teams, or YCOTs, currently have an increase in the budget on both the Senate and House side, as well as an increase for Yes Waiver funding, which is for, if you haven't heard of this program, it is for youth with high behavioral health needs to give them support so that they can stay in the community. And then mental health and intellectual and developmental disabilities outpatient services, there was an increase in the budget for that, which would impact some of y'all's organizations that work with those folks. And substance abuse services are at a consistent level with how the state funded them last session. However, there is a lot of unknowns right now with the federal funding. So just know that when I'm talking about the consistent funding, I'm talking about the state funding. I'm not talking about what the federal funding looks like coming down to the state. One thing I did want to talk about, because I know some of y'all take private insurance. So one thing to note before I go through these themes of bills is that in the private insurance landscape of Texas, only 15% of Texans have plans that are regulated by the Texas Department of Insurance. The majority of Texans have plans that are actually regulated by federal agencies. What this means is that when the state files bills on private insurance, it only affects those 15% of plans. So just keep that in mind when I'm talking about bills that are related to private insurance. It might not affect the clients that you work with or that you serve, because those clients have their private insurance regulated at the federal level. Workforce. There are a ton of workforce bills this session, so I'm not going to use bill numbers. If you would like to look up these bills, I encourage you to take the language that I am sharing and type it into Google and say Texas legislation or Texas Legislature 2025. And it should bring up the bill. But I'm just going to show some themes for topics that have been filed this session so far. There is a bill that would allow Texas to join the Social Work Compact, allowing people to work more easily across state lines if they meet requirements. Same with Texas joining the LPC Compact. I did want to note that Texas is already in the Psychology National Compact, so you may be wondering why just social work and LPC, so that is why there. There's also a bill related to that loan repayment program that I brought up earlier, um, loan repayment program for mental health professionals. This bill would add new professionals to the program, LMSWs, LPCA, LMFTA, and it would increase funds across the board for all the professions. And it would allow one-time stipends for people who are bilingual and speak another language, and for people who work in a county with less than 150,000 people. There's also a bill that would align out-of-state reciprocity rules for people coming into the state that are trying to get their licensure in Texas for LPCs, social workers, and LMFTs. There is legislation that would create a paid internship program for social work students. I know that that is a big interest, especially for people that work with those interns. And then another that would allow for school boards, so local ISDs, to require social workers that work within their schools to have 80% of their duties be related to their job as a social worker and defining what school social work is. It is actually not in the education code on what school social work is. School counseling and school psychology is in the code, but not school social work. And then last is legislation that would change the school counselor ratios. Medicaid, there are several Medicaid topics that are on top of mind this legislative session. One is legislation that would allow LMSWs, LPCAs, and LMFTAs to bill Medicaid for psychotherapy or counseling. Other bills that would add multisystemic therapy as a benefit. Okay, that is my 5-minute warning to myself, so I am aware of the time. And then one that would add functional family therapy as a Medicaid covered benefit, as well as legislation that would require certain inpatient mental health services to be covered by Medicaid, as well as adding crisis services, inpatient, and then partial outpatient services, IOP and POP, partial outpatient services, yes, to be funded by Medicaid. Commercial insurance, again, remember what I said earlier, this is only for the 15% of plans that are covered by TDI. Legislation that would allow substance use treatments to be covered at parity with other illnesses and the disorders to be covered under Texas state employee insurance plans, so people who work for the state. There is legislation that would remove prior authorization for certain substance use services. Also, legislation that would add an autism benefit to commercial insurance. Another one that adds serious emotional disturbance as a required diagnosis for children. I did want to note, because I got this comment in a presentation a couple of weeks ago, is that we know that this is not the respectful first person language or person first language, but this is how it is defined in the insurance code. And so this is how it is in the bill, but we recognize that it is a stigmatizing term. And then last is legislation that would add first episode psychosis treatment. There are a couple of big bills related to telehealth and telemedicine. One would allow health professionals licensed in other states to provide telehealth services to Texans without a Texas license. There's also legislation that would allow telehealth services to be administered to Texans by people outside of Texas as long as they are licensed to practice in Texas. Right now, you have to be licensed in Texas in order to provide telehealth services to Texans. AI, there are a few interesting bills related to artificial intelligence and social media. There's one that would limit the use of AI in counseling, therapy, and other mental health services, requiring a licensed professional to be supervising that. There's also legislation that would require a warning label on social media platforms about the association between a minor's social media usage and mental health issues. And then last is legislation that would actually ban children from using social media platforms. A few other just general mental health topics. There is a bill that would create a Mental Health and Brain Research Institute of Texas. There is a bill that would create the Dementia Prevention and Research Institute of Texas. There are several bills that would create a school mental health allotment within the budget, so there would be a dedicated funding item to fund school mental health services. And then another bill that would create a trust fund for the 988 crisis hotline. So I am at the end of my time there, and I am happy to pass it along to Peyton.
Awesome. Thank you so much, Allison, for that look at the legislative landscape and the impact that it will have here in Central Texas. Now that we've heard a little bit about the policies being enacted and funding decisions, I'll be speaking a bit on how as a community we respond, and that in relation to coalition building and community organizing and how that can come in. I'm going to share my screen first with everybody. Awesome. So before I dive into that, I'll share a little bit about myself. Again, my name is Peyton Wagner, and I'm the Behavioral Health Coordinator for Hays County. This is a new role to Hays County. Next week will be my 1-year anniversary in this role, but previously I worked at Senacor managing a SAMHSA grant. And I'm currently also in a master's program to pursue a career as a professional licensed counselor. So I've always had a passion for working with people individually, but through this role, working in local government and the county level, it's been very rewarding and challenging to take what I've learned at the individual level and try to see how I can apply that to systems thinking and have that macro overview. So I'm going to hop into kind of talking about my experience with coalition building as the behavioral health coordinator. That was one of my first tasks, was to create a mental health coalition for Hays County. First, I wanted to share this visual that helped me when I was starting to kind of conceptualize the power that a coalition could wield. And this depicts the 3 different levels of power when it comes to building health equity. So at the top, you have visible power, which is kind of what Allison touched on, and what I think of normally when I think of political power. It's the regulations, rules, laws made by public officials. What I'll really be focusing on is levels 2 and 3 and how that can really make a huge impact. Level 2 is what is known as hidden power, and that's building infrastructure to influence what's on the agenda. So what issues are being addressed, who's at the decision-making table. And then level 3 is known as invisible power, changing narratives and worldviews to shape what is possible. So how can we challenge current dominant narratives, activate key values and beliefs to shape public debate, and shape how people consciously and unconsciously think about and interpret the world around them. So when I was making the mental health group, my first step was to identify the key players. It was really important that we wanted these coalitions to be community driven. Fortunately, my role at Senacor, I had built a lot of relationships with social workers and community organizations doing mental health work and social work in the community. So that allowed me to kind of get everyone together. And one of my tips for coalition building is definitely spend a lot of time up front at the beginning, making sure that there is a clear mission and vision. I want to say we probably spent the first 4 or 5 meetings. And for context, we meet once a month regularly. So the first 4 or 5 months, just having listening sessions with our community, brainstorming what we wanted our outcomes to be. And I think at times, while it felt very slow moving, it was worth it to have that solidified vision of what we wanted to accomplish with our groups. And I think now, just a year later, we're starting to see some of the fruits of that labor that we took on the front end to invest in having a solid foundation. For example, and I can share a little bit about especially power number 3, invisible power, and how we've kind of worked in that space. As a lot of coalition groups, I imagine we don't have a specific allotted pool of funds. These are just people who are passionate and care about doing mental health work in our community. But one of the things that's really stuck with me that our director at the health department said was, even without funding or limited funding, we can focus on the 3 Ps, which is partnerships, programming, and policy advocacy. So we have our adult mental health work group is doing quarterly lunch and learns. We have one next week where we have 60 community members registered to get trained in CALM, which stands for Counseling on Access to Lethal Means, and is a suicide prevention training. And this whole event is done through partnerships. The city of Wimberley is letting us use their community center for a venue. Our speaker is with our local mental health authority, and who is a member of this coalition group. And then a treatment center is sponsoring the lunch. So that's been something that we've been able to do, and we're going to continue to do, to support mental health education and equipping our community with that tool. We are also doing a digital campaign series with Texas State. They're letting us use their virtual production studio, and we have community members who are going to be sharing their mental health journey. And the goal of that is to challenge current dominant narratives about what it looks like to struggle with mental health, provide hope, and kind of shift the stigma. And Texas State has been great. They have some film students who wanted to help get experience working on a set that they're going to be doing the filming and the editing. So these are just creative ways that even with limited funding, we've been able to kind of address what we want at a local level. Next, I'm going to kind of touch into how we started to move to hidden power and influencing which issues are being addressed at the local level. And that is through this Hays County mental health collaborative structure. So sorry, this is a very rough rendering that I did quickly just to demonstrate. But at that top level, the youth mental health work group and adult mental health work group, those are the two coalition groups that I help facilitate, that are comprised of people in the community who are doing the work. The behavioral health advisory team, that group was long established before I came to this role, and it is full of professionals in the criminal justice system. So like our Hays County district attorneys, our mental health court, police chief, and they're working on solutions where for people who are struggling with mental health and are in our legal system. So the commonality in those groups is that those people who are comprised are the experts and seeing the issues that are facing our community day in and day out. So what we've done here in Hays County is we created a mental health coordinating committee, which is this lower group. And we had the chairs of each of these work groups and smaller subcommittee coalitions join the mental health coordinating committee. So they are the voice, ideally, of the community and the experts. And then along with them, the chairs in the group, we have city representation. We have each of the 5 big cities in Hays County council members represented, as well as a commissioner for Hays County. And so the idea with this structure is to create a dialogue between our policymakers and our people who have some of that political power locally with our experts in the mental health field to drive solutions. And so that's how our coalition has kind of been able to move up and build momentum into leveraging those 3 different powers when building health equity. So I wanted to share that as well. So that's a really brief overview of some of the coalition work that's happening in Hays County. Another tip I would say is that has really helped our coalitions is I think at the beginning, we also made sure to review our community health needs assessment and our Meadows Mental Health Policy Institute assessment, and rely on data to kind of drive our goals and our outcomes. And I think that was really powerful, especially when speaking with our government representatives, to be data driven and show impact. So that's another tip that I would share. But overall, that's all I have. And if you're in the Hays County area and interested in joining our coalition, we would love to have you. I know Shelby and Cody have my contact info, and we'll share that. But if you are not in the local area, I encourage you to maybe research and see what coalitions or work groups are in your area that maybe intersect with your passion, because I really do feel like now is a time to really lean into collective community action to drive change. I know Hays County, we have a homeless coalition, and we also have a suicide prevention coalition. So there's a lot of different groups out there. So I definitely encourage you to get involved in that capacity.